Mercy Mission Hospital was officially opened on 2nd March 1969, and therefore we are celebrating the year of Jubilee. And this is a very important occasion to us as Mercy Hospital because it's a moment of reflecting about our past.
Mercy Mission Hospital was started as an outpatient, initially for the community of Eldamaravine. It grew to an hospital where it started serving people from the whole of Baringo County.
I came here in the year 2013 and we had very few patients since that time, but now we want to register the number of patients that have really gone up, and now the hospital is able to contain 108 patients, and we are really happy that now we are able to have all the professionals. We have all the professionals, the gynecologist, we have the general surgeon, we have a resident surgeon who is able to do the emergency. And apart from that, we have an emergency team in the hospital, which is comprised of nurses, the clinicians, we have the medical officers, we have all the staff that are required, and we've seen the trend and the growth in the hospital.
Mercy Mission Hospital has been having great opportunities to be part of the health services in Baringo County. And as a hospital, the successes that we've seen with the delivery of the health mandate is of late the surgeries that are happening in our hospital. This is because we are blessed to have a resident surgeon .
Of this hospital as a vision as a hospital of excellence in provision of health care, in provision of holistic care. We also as a board, we are to provide accessible, affordable, quality health care to the community within the Christian values.
Hospital is really coming up with the very unique programs. Like we have one unique program, the HHA, we call it Health at Africa, which is a program that is taking care of the NCDs, non-communicable diseases, like hypertension, like diabetes. We have cancer, especially for cancer cervix for the women. That is the program that the patients, we formed as a group, that we have more than 200 patients on the same, who share the same challenges, and they are coming here for training, and they pick their drugs at a very low cost, like 200 shillings per month. And we've seen also the growth in the hospital because of the insurance companies that we have. We accept NHIF as our main insurance company, and we also have the Britam, we have CIC, we have Jubilee Insurance, and so many others that are accepted in our hospital. We also have the Linda Mama program to take care of the maternity and antenatal care. So we have the Linda Mama program. A mama come to the hospital expecting the baby. They work in and work out without any payment because the program stands for the women who are in labor.
We have 6 clinical officers with one specialty of anesthesia. We basically manage the outpatient setup mostly, and occasionally in inpatient. Our hospital serves, being the only level 4 private facilities within the county of Baringo, and the only mission hospital of that level again in Baringo. We are serving the entire county and other neighboring counties, around 5 of them involving Elgeyo Marakwet, the bordering side of Uasin Gishu, Kericho, and Nakuru counties. We also serve majority of the East Pokot that receive their services from our facility.
Also, this being a mission hospital, many clients would prefer because of the affordability of the services, and we get a lot of support from other partners. That includes the county government of Baringo, and also other stakeholders who work with us closely, like the insurance companies, the banks that are within Eldamaravine. They have really given us a lot of support to be able to execute our mandates.
The hospital is very clean because we have our own cleaning services. We have a cleaning department, we call it housekeeping department, which is really doing a good work to make sure the hospital looks home and away from home. A lot of water in the hospital, we don't have any problem with water. So there is no day we are having shortage in the hospital because we have a borehole in the hospital. We don't buy groceries. Most of the things we get from the shamba, like the green vegetables. We have the onions, we have tomatoes from our shamba, we have the greenhouse. So most of the things is able to cut our prices down because we don't buy most of the groceries. And at the same time, we have a utility car that runs around for the small utility work in the hospital. Apart from that, we have ambulance, 2 ambulances in the hospital. We have the latest ambulance that is well equipped. It has oxygen, it has ventilators inside, it has the van, it has everything that is required to carry the patient from our institution to another institution.
Out of this, we've noticed there are some challenges that we have realized, more so during the critical surgeries that we are having an opportunity to undertake. These are the cesareans or the orthopedic surgeries that Mercy Mission Hospital has currently undertaken. The main challenge has come out of the availability of blood. That is a very critical component of any surgery. We have realized that our far-flung distance from Nakuru makes us not have this critical factor sometimes available at our hospital. But the community we have seen currently are very willing to be part of the blood donor services. We want to encourage the blood donor services to partner with Mercy Mission Hospital to have collaborative health camps that will involve blood drives that can happen even here on monthly basis. Blood donor services giving us 1 or 2 medical officers to facilitate in the blood donation.
we have been able to come up with a strategic plan that is going to take us for another 5 years, and not just 5 years, maybe another 50 and 100 years. And in our strategic plan, we are emphasizing especially the things to do with the leadership, emphasize quality of service delivery, things to do with the customer care. In short, what we are doing, we are trying to create policies and structure for the hospital to be able, to go for other many years. In a special way, I want really to thank all our partners, our suppliers, and all people of goodwill who have helped us to be where we are today as Mercy Mission Hospital. For us, we always say, we are just participating in the healing ministry of our Lord Jesus Christ. We are just in response to that call of healing the people of God. Because healing ministry is at the center of Jesus' proclamation of the good news. And for us, that's what we are doing as Mercy Hospital, offering services